So, what are the quality system requirements for repackager and relabelers for the FDA? We actually got this client that contacted us this week and was asking that exact question. They're a company that repackages and relabels product, but they had no idea what the requirements were for having a quality system. They had a manual that they had created, but they didn't have procedures to go with that manual, and they were asking us, could we help them? But they didn't think there were a lot of requirements for a quality system, maybe just something for label control. And unfortunately, that's not the right answer. There are a lot of requirements for repackagers and relabelers, but there are certain requirements that are not applicable to a company that's just doing repackaging and relabeling. And it depends a little bit on what we mean by repackaging. In general, we're not talking about taking things out of a sterile primary package and putting it into another sterile primary package and then re-sterilizing it. That would be called reprocessing. And that's a whole nother thing that would actually require, if it's a 510K cleared product, a new 510K for your company. So if you're just repackaging, what that usually means is you're getting bulk product and you're putting it into smaller packages, or you're putting it into a kit of some kind, but you're not damaging the primary sterile barrier for the product. So let me go through I was showing up ahead of time. We have 25 required procedures that are in our training for 21 CFR 820, which is the FDA's quality system requirements. And I'm going to go through each of those and explain why it's required and why it's not required, depending on which the procedure is for a company that's repackaging and relabeling. But when I say repackaging, I'm not talking about taking something out of a sterile barrier. I'm just talking about putting it in another secondary package. This is the outer carton or box or kit that it's put in, and putting your label as the distributor on the product. So number one, do you have to have a management review? Yes, you do. You're going to have to be registered with the FDA as a repackager labeler, and you're going to have to conduct management reviews. So that's one of the requirements. There may be some inputs in that management review requirement that may not be applicable to your company, but most of the requirements in that management review will be required inputs for your company. So you do need a management review procedure. Number two, do you have to conduct internal auditing? Yes, you do. So that's a second procedure. Number three, training. Yes, you have to have a training procedure if you're registered with the FDA, and you have to have training records, and you have to document training requirements. So that's a yes as well. So far we're 3 for 3. Design controls. This one you shouldn't need. The only part of design that you're actually going to need is to control changes, and they're going to be specific to the labeling. And because you could put all those requirements in your labeling procedure, you could probably skip this requirement. You're not going to have a DHF because you didn't design the product, but you are going to have a DMR, and that's in a different section. And our company puts the DMR requirements in our production process control. You might want to put it under something else, but you're going to have a DMR for the product that indicates what things are going to be included in your product, and all the inspection and work instructions that are applicable to it. Those should be included in your DMR as well. So even though you don't have to design the product and develop a design history file, you do have to have that device master record that says what goes in your product now that it's repackaged and relabeled. And you're not going to have all the details of what's in your supplier's product. You're just going to say, we're going to take this unit that they give us, and then we're going to put this packaging and labeling around it. So it's a very short bill of materials or BOM that lists their subassembly or finished device as one component. The next item is document control. That's definitely a yes. You're going to have to have a document control procedure where you revise and update procedures and control them, including documents of external origin, such as standards and regulations. Next item is purchasing. You definitely need a purchasing procedure. You're going to have to control your suppliers, have an approved supplier list, do supplier evaluations, because you're going to buy these packaging materials from somebody and these labeling materials from somewhere. You also need to consider whoever's providing you with the finished device that you're repackaging and relabeling as a supplier. So they also count. So you should have that agreement between them. It might not be called the supplier quality agreement. It might be a distribution agreement because you're distributing the product. But you want to define who's going to be doing the complaint handling, who's going to do the investigations, who's going to do the MDR reporting, who's going to do recalls. Those kinds of things have to be spelled out. And also, if there are any changes made to the labeling by your supplier, you need to be notified of it. So that needs to be included in there too. Next one, receiving inspection. So when you receive product from your supplier, you're going to be inspecting that in some way. You can't open up the sterile barrier, but you can still check to make sure the label's correct that they put on it. Make sure the expiration date is appropriate. Make sure they didn't mislabel items. Make sure there's no damage to the product. Make sure all the paperwork's correct. Those are things that you'd be checking when you inspect those products. So you do need some sort of inspection. And any packaging materials you get, you're going to inspect those. Any labeling materials, you're going to inspect those. And of course, you inspect the labels you create. That would be in-process inspection. But yes, you need receiving inspection as a procedure. Manufacturing SOPs. No, you don't manufacture your product, but you do package it. So whether you call it a packaging work instruction or a labeling work instruction or manufacturing SOPs, you do need that for the processes you perform. So that'll be applicable too. So far, really, design's the only thing we've eliminated from the list so far. Next is process validation. So process validation is only required if you have something automated. In today's world, it's almost unheard of to be hand printing or manually printing labels one at a time. Almost everybody's using some kind of software, and because of UDI requirements, you're going to need something like Bartender or some sort of label software that allows you to create this 3D barcode, or I'm sorry, a 2D barcode or a 1D barcode that's UDI compliant. So I'm almost certain you're going to have validation of your labeling creation and label printing, and you may have other types of software, such as an inventory control system, something keeping track of lots, incoming purchase orders, outgoing shipments. All of those things are probably electronic, and you're probably going to have to validate them. They could be under a different type of procedures, such as software tool validation or quality system software validation, but you're going to have to do some validation, guaranteed. Next item on the list, identification. This is the lot traceability or serial number traceability. So if you have a device that has a serial number, such as an implant or any electronic device with a printed circuit board, you're going to have to keep track of those serial numbers, and everything else will have lot control. You're going to have expiration dates. You're going to have UDI compliance. That requires identification. Identification also covers identifying the status of products. So is this under quarantine? Is it ready to ship and released? What is the status of this product that you have, and is it in the right location to properly identify and segregate it from other product that is different? So that's something that has to be done. You might even put line clearance in that if it's not in a manufacturing procedure. Next item is traceability. A lot of times we will put identification and traceability into the same procedure. That's what Medical Device Academy has done. It's possible that you don't have any traceability requirements if you have no serial numbers, but a lot of companies have serial numbers with electronic devices, so they do have traceability. So you can combine the two into one, or you can have two separate procedures, or in certain cases where you don't have traceability requirements, you could eliminate the traceability procedure and say there's no requirement for traceability with the products we make. Installation, very unlikely that you're going to have this for a repackager and the relabeler. Installation is not installing software. Installation is not plugging something in according to the instruction for use. Installation is where you need outside services such as plumbing, electrical installation, such as you're going to have an electrician install something. If you need a rigger to lift something heavy, this is the kind of thing you do for CT scanners and MRIs and X-ray equipment. It's not the kind of thing you do for something small and relatively easy to plug in and load up. So you're probably not going to have installation, and I would be shocked and amazed if we had installation for a repackager labeler, because they wouldn't typically be working with that type of equipment. Service. If you are, in addition to the company that's doing the repackaging, relabeling as a distributor, you're also providing service to devices. So companies or users, end users, ship product back to you that needs some sort of service and repair done. Those would require service procedures. If the device is a single-use disposable device, there's no service possible, then that's not applicable to you. So that's a question mark on that one. So far, I think we've gotten maybe 3 or 4 procedures that might not be applicable: design, traceability, installation, and service. Maybe validation, depending on whether you have your software as a separate one, but you're probably going to have to do some sort of validation, but maybe not on the process, maybe on just software. Next item is calibration. If you're not doing any measuring, no measuring functions like weighing, what is the dimension of something, you don't need this. But even for a company that uses labels, they're probably going to measure the labels. Even a steel ruler has to be measured. So if that's part of your inspection procedure, is to make sure the labels are the right size and the boxes are the right size, then you're going to have to do some measurement, and therefore you're going to need calibration. It may be very simple. A steel ruler may be one-time calibration. You buy a calibrated ruler, you have a calibration certificate of it, and as long as the ruler doesn't get bent or damaged in any way, and you store it well, you don't have to recalibrate it. But other types of measurement equipment would typically require you have a list of calibrated devices and you recalibrate them on a regular basis. Next one is control of non-conforming product. Whenever you repackage and relabel things, you're going to find things that got damaged or things that aren't correct, or you label something incorrectly. So you're definitely going to need control of non-conforming materials procedure. You're going to need a CAPA procedure. This is corrective action, preventive action. That's required for correcting any problems. The FDA finds it. You find it in an internal audit. You whatever it is, a customer complaint. Those are all things that would require CAPA. So that's definitely a requirement. Packaging. Well, you're a repackager, so you're going to need a packaging procedure. Definitely. Storage. You're going to store the inventory that you receive from your supplier. You're going to store all your packaging and labeling supplies. You're going to package or store in-process materials, so pre-printed labels that are queued up for a job that hasn't been relabeled yet. And then the finished product. All of those cases, you definitely have storage as a requirement. Handling. So this would be your shipping, distribution. That's definitely something you have to have. Labeling. Yes, of course, you need labeling controls and a labeling procedure, and make sure that you have a very strong labeling procedure. And it's going to be a little different from your normal labeling procedure where you identify how to create the label from scratch. In your case, you're going to be talking about how you can make revisions and what things you're allowed to revise and what things have to be maintained the same. So if your product that you're repackaging and relabeling has an instruction for use that was cleared by the FDA, you can't make changes to the content of everything in there. You can only make changes to certain content specific to branding and the company identification. So the manufacturer, place of business, the address, the phone number, the website, those things you can change. The branding you can change. But even the part number you could change. But you can't change the instructions and warnings and precautions and how to use the device. Those things you can't remove or even change. Another thing, recalls and advisory notice. So if you make a mistake on anything, you're going to have to recall that product that you made the mistake on. So you're definitely going to need a recall procedure. That's something that you're going to have. And if your supplier has a recall, you're going to have to help them facilitate the recall because you distributed that product. So one way or another, you're going to have a recall procedure and have the ability to help your supplier do recalls if they do it. And that should be covered in your supplier quality agreement or distribution agreement. Next, we have record retention. That's definitely a requirement. All the procedures that we talked about, almost every single one of them is going to have records. You're going to have to retain those and store those so they can't get damaged, and they have to be legible records. And you have to prevent them from being inadvertently changed in some way. So somebody can't just erase things that were written in pencil. You have to be writing them in a way that they're not going to be easily changed. Next, complaint handling. Of course, you're going to have complaint handling because your name's on the address, not your supplier's. So they're going to contact you, not the supplier. So you definitely need a complaint handling procedure, and you have to determine whether the complaints are going to be addressed by your company, your supplier, or a combination of the two, depending on what the issue is. MDR reporting. For any initial importers, you are required to do MDR reporting. So that might be double reporting. That's okay. But anything you receive complaints about, with it's labeled with your name, you're going to have to do this MDR reporting, or you're going to have an agreement in place that says you're going to pass this information along to your supplier. They're going to do the reporting, but be very careful because the FDA doesn't just automatically exempt you from it if you have an agreement. There's actually been some cases in the past where companies that were contract manufacturers were also required to do MDR reporting, and they said, no, we have an agreement that says we don't have to. And the FDA said, you have to actually request an exemption from that and show us the documentation. We have to agree to that before you're actually exempt from MDR reporting. So if your company has an agreement that says your supplier is going to do that and you're not going to do that, you still have to get permission from the FDA to exempt that requirement. And chances are they're going to say no. And that includes the electronic submissions gateway that you're going to have. The last requirement on the list of the 25 required procedures for the FDA is statistical analysis. And people are like, well, I'm not doing anything like verification and validation testing that would require statistical analysis. If you read through the the QSR or search for the word statistics, there are a few places where you're required to apply statistics. One of them is going to be CAPAs. So you have a CAPA procedure, you have to do statistical analysis of CAPAs. There are other areas where you should also be doing statistical analysis. So supplier metrics, non-conforming material, any internal audits, any non-conformities in general. These are all areas that you would also be expected to be doing statistical analysis. Complaints would be another area. So you're going to have to do some kind of statistical analysis. And if you're doing any kind of validations, you might have some justification of the statistical sampling size or statistical justification for why you did this many in your validation. So it's likely you're going to have some statistical sampling requirements. You also are required to do statistical sampling of any incoming product. So when you receive these labels, what is your sample size that you're going to inspect? So you're not going to get out of that procedure either. So after we went through the whole list of 25 required procedures, almost all of them are required. So in fact, a company that makes software as a medical device has fewer procedures that are required because they don't have physical product than a company that's a repackager and relabeler. So to think that you're going to get out of having a quality system and only have a couple of required procedures, you are mistaken. So before you enter into this enterprise and you decide we're going to do repackaging and relabeling, think again and get some helpful advice on what do we need and how do we need to change an ordinary procedure into one that fits for our organization. It doesn't have to be extremely labor intensive, but you are going to have those procedures and you're going to have to create those records. If you have any other questions for me, please let me know. I'm trying to think. It almost seems like there was one other. No, that's in there too. So I think I covered everything. Thank you very much for participating in this live streaming webinar or live streaming video on YouTube. And please don't forget to like and subscribe below. And for one last announcement, next Monday, we have a live webinar that we're doing on how to write an IFU. So very pertinent for anybody that's going to be getting involved in repackaging, relabeling. I will make sure that I have a short section about what you do when you're a relabeler, how you're going to manage that IFU. But the most of that webinar is focused on how you write a first IFU for an OEM supplier that's actually going to be preparing a 510K or CE marking or Canadian license, and how do they create their IFU from scratch rather than just copying a competitor. Not a good idea. Hope to see you next Monday, and if not, we'll also be doing a live streaming video next Friday. I think that's the 4th at 12:30 p.m. Eastern time. See you then. Bye-bye.